Hi there, this is Dr. Jenny Yoon. Welcome back. This is our show number 4. Today we're going to talk about how to talk to kids about your breast cancer. Talking to kids about your new diagnosis of breast cancer can be one of the most daunting tasks. I've heard words of wisdom and advice from many patients whom I've diagnosed with breast cancer. You know, I don't have a degree in psychiatry and I'm not an expert in children. But what I have is compilation of knowledge gained from talking to these survivors. So today, I'm going to share with you what these survivors have taught me. Children are smarter than you think. They sense something's wrong. But before talking to your kids, you need to be able to deal with this cancer yourself. You can't give reassurance to your children if you can't face it yourself. So you have to gain strength about your disease. And if you need help, you go talk to a psychiatrist or a therapist so you can deal with this issue. And when you're ready to face your cancer and go head on with it, then it's time to tell your children. One of the main concerns that children, especially the young ones, have when they know you're sick is who's going to take care of them, who's going to take them to school, who's going to feed them. So you have to have a plan before you start your treatment on how you're going to provide these things, and you have to tell these children how you're going to do that so they feel like their lives continue as you undergo your treatment. Experts say that young children feel safe and secure if you maintain routine and schedules. This means that you can't start feeling guilty about your treatment and not being able to spend as much time with them. So you start letting them stay up later, giving them more treats. You can't do that. You need to enforce what you already have. And there's nothing to feel guilty about. You're doing the best you can to stay alive for your children. So take the pressure off of yourself. And you need to reinforce these routines that you have created before you got diagnosed. The other thing that children get concerned, especially the girls, is that will they get cancer too, especially when they start seeing you lose your breast and see these physical changes. But the important thing is that you have to tell them that breast cancer doesn't occur in young children, and so there's nothing for them to worry about for now. And the doctors are working on this cancer all the time, so by the time they grow up, there may be more preventive options and more treatment options. The other thing is if you have to get chemotherapy, you're going to have side effects such as losing hair or getting very sick. So how do you explain that to your children? Hair loss, in terms of that, explaining that to your kids, some people say it's best to explain chemotherapy as a strong special medicine that kills mommy's cancer cells. But the drug also damages other cells, such as those that make your hair grow. And you can tell them by losing hair, it's a sign that the medicine's working. Losing hair is a good sign because it's getting rid of your cancer. The other thing that comes up is that when you have cancer and you're undergoing treatment, you may get multiple visitors, and they may come at all times of the day or multiple times in the day. And some of the children resent that, not because they don't want you to get the support, but their routine's disrupted. So it may be helpful for you to set a schedule on who comes to visit on what day, so they don't just randomly show up. And that allows your children to spend time with you and have this normal routine, which experts say is very important. And the other thing is you need to ask your children if they'll help you. They feel like they're a participant in helping you get better. Make a list of chores that they can help you with so they feel like they are actually doing something to help you beat this disease. It's also important to check in and tell your children and ask them what's going on, what they're worrying about, what they're feeling with your disease. And this lets them know that you're still interested in what they're thinking, and also you're there for them so they don't have to worry alone. One of the toughest things is if you have terminal breast cancer, how do you tell your kids? It's hard, but it's important for you to engage your children so you make the most of the time remaining and meaningful as possible. You need to also prepare your partner or spouse to be the caretaker so he can continue to provide support for children when you're gone. And throughout this, you need to maintain sort of sense of this family connectedness and how they can remember you after you're gone. It's okay to cry, and it lets your children know that they can express their feelings and tell you what's going on. It's hard to end this program by talking about death, but let's think positive. Breast cancer can be cured if diagnosed early, and to do that you need to do a breast self-exam every month, get a mammogram every year if you're old enough, and see a doctor at least once a year. These simple things will help you live. If you don't want to get a mammogram because it's uncomfortable, then you need to do it for your children. You need to do it for the girls. This is Dr. Jenny Yoon. See you next time.